I'm Dr. Carlo, and the topic of my presentation is the following: short-term efficacy and safety of navigated microsecond pulsing laser treatment in patients affected by macular edema after branch retinal vein occlusion. Brief introduction about the two different laser systems. We have to differentiate the continuous wave mode that we used in the past and also today for a traditional laser treatment. And we can affirm that in this kind of laser treatment, the laser energy is delivered with a single pulse, whose width constitutes the exposed duration. In the macropulse mode, we have a different way for the delivery of the energy, because in this case we have a train of repetitive short pulses, about 100-300 microseconds, with an envelope whose width constitutes the exposed duration. We can see the difference in the image at the bottom. In the case of continuous wave mode, we see only a single pulse, while in the microsecond pulse treatment mode, we can see the different train of repetitive short pulses. The purpose of our study was to evaluate and correlate morphological and functional early outcomes after the navigated microsecond pulsing laser treatment in patients affected by macular edema after an episode of branch retinal vein occlusion. In addition, we analyzed the safety of the laser treatment in the postoperative follow-up. From November 2018 until May 2019, treated 18 eyes for 17 consecutive patients that were affected by macular edema. A navigated microsecond pulsing laser treatment was executed in the eye affected by macular edema. The follow-up period was at 3 months. As pre-treat assessment, we used the visual acuity test and the spectral domain OCT macular analysis. The visual acuity test was made with LogMAR BCVA, a standardized LogMAR chart. As spectral domain OCT measurements, we assess the macular thickness based on the ETDRS grid, and in addition, we assess the integrity of the ellipsoid zone and the cone outer segmentin slides, which represent the main photoreceptor structures. We include all patients with a diagnosis of macular edema after an episode of branchial retinal vein occlusion, and the diagnosis was confirmed by fundus photoexamination, fluorescein angiography, and spectral domain optical coherence tomography. In order to reduce the bias of our results, we exclude all the patients affected by central retinal vein occlusion, diabetic macular edema, and previous intraocular surgery, except for uneventful cataract, glaucoma and optic neuropathy patients, patients with an history of ocular inflammation such as anterior, intermediate, and posterior uveitis, patients affected by high myopia and other form of maculovitis, and patients with a previous retinal detachment. So this is a typical image of a multimodal imaging assessment of a patient with macular edema and branch retinal vein occlusion. And now we have the microsecond laser treatment procedure, and I would like to explain every step of the procedure. From the beginning, we execute a spectral domain OCT raster fast scan, and we save the OCT image in a USB pen drive. We import this image inside the Navilas computer. Then we took photos of the patient's macula with the integrated Navilas camera. After that, we manually overlapped the OCT image and the fundus photo image with the aim of the Navilas software. We set the treatment plan of the macular area affected by edema based on the overlapped image. And for example, the red and orange area displayed by the spectral domain OCT color thickness map. We titrate the laser energy at the beginning with a continuous wave modality outside the vascular arcades or far from the macula center. When the effect of the laser, for example, a light yellow spot, was clearly recognizable, the energy power has been doubled and the laser started to switch from continuous wave mode to microsecond modality with a 10% of duty cycle. So here we have an example of the laser treatment procedure. In this image, we see the fundus of the patient, then the overlapped OCT image with the red color where the macular edema was. And here in the third image, left bottom, we can see the treatment plan and the caution zone that we set at the level of the optic nerve head. So another image of the treatment plan and the caution zone. And then here we can say another time the treatment and also the treatment parameters. Another example of a patient treatment in our study. In this case, we use the following parameters: 638 spots directed to the edematous area. The microsecond pulsing laser treatment, we used 10% of duty cycle. As energy power, we used one as parameter 100 milliwatt. It means that we titrate with 50 milliwatt energy and then we double the energy power using the microsecond pulsing mode to perform the treatment. As pulse duration, we use 100 microsecond, as spot diameter 100 micron, and we don't leave any spaces between two laser spots. As OCT parameter, we assess the fast macular thickness scan. The thickness analysis was considered at the central subfield and at the four external subfields of the ETDRS plot. We measured the integrity of the ellipsoid zone and the coast lines. The functional parameters was assessed by logMAR BCVA, and at the end we correlate the postoperative functional and the morphological parameters. So we treated 18 eyes in 70 patients with macular edema. The mean age of the patients group was 17 years. The mean logMAR visual acuity at the baseline was 0.5 logMAR, and the mean central retinal thickness, as we can see before the laser treatment, was about 338 micron. We use as mean energy about 127 milliwatt, and the mean number of laser spots was 656. In this image, we can see the first result of our study, mostly the case of visual acuity at 1 month and 3 months. As we can see in the two graphics, we see an improvement of visual acuity both at 1 month and at 3 months, but at 3 months we can see statistically significant results. We assess also the central retinal thickness 1 month and 3 months after the laser treatment. As you can see, we had improvement of the retinal thickness, a reduction of retinal thickness, both at 1 month and 3 months, but we didn't reach statistically significant results. So here, in addition, we see the most important part of our study, the most important results, because we assess the integrity of the ellipsoid and the coastline. It means that we assess the structure of photoreceptor, and we can observe statistically significant improvement of both structures at 3 months, at 1 month, mostly in the case of coastline. In this image, we correlate the post-laser treatment visual acuity, so the functional results, and the integrity of photoreceptor structures, so the morphological part. And we can see a significant correlation between the visual acuity and the integrity of the ellipsoid zone. I mean, it's a very important result because we assessed both the functional and the morphological results of our study. In addition, we observed no complication after the laser treatment procedure, such as a retinal scar or choroidal neovascularization. We observe no worsening of the macular edema condition and no deterioration on the visual acuity. In addition, we observe no worsening of the vascular perfusion of presence of retinal hemorrhages, no pain or disturb perceived by the patient during the laser procedure. This is an interesting clinical case in our cohort of patients. This is a patient of 70 years old woman. The diagnosis was made in 2016. The patient had a good response to anti-VEGF therapy in the previous years. The visual acuity before the laser treatment was about 0.1 logmar. And as we see in the right part of the screen, with the spectral domain image, we see the presence of intraretinal cyst and a mild alteration of the photoreceptor tissues, as we can observe in the red square. Here we have the parameters that utilize for the laser treatment procedure, 318 spots directed to the edematous areas based on the spectral domain OCT image. We utilize a 10% duty cycle. In this case, we titrate with 70 milliwatt and we double the energy. So the energy that we use in this case about 140 milliwatt. The pulse duration and the spot diameter is always the same as we saw in the previous images. So 100 microsecond and 100 micros, no spaces between two spots. At 1 month, we have stable visual acuity and we can observe a reduction of intraretinal fluid. Really interesting is the 3 months follow-up, and we can observe improved BCVA logmar, so a very good visual acuity. And the spectral domain OCT shows the absence of intraretinal fluid and the central retinal thickness reductions, really important, as we can see in the image at the bottom and on the left inside the square. If we compare the two images before and after the laser treatment, we can demonstrate the restoration of the focal ellipsoid zone and the coast lines, so the most important photoreceptor structures. So we have the conclusion, and we can see the Navilas microsecond laser pulsing treatment shows to be an effective and safety valuable tool for the treatment of macular edema in patients affected by branch retinal vein occlusion. A significant improvement of visual acuity 3 months after the laser treatment was observed. In addition, we demonstrated a significant restoration of the photoreceptor structures, such as the ellipsoid and coast lines, already 1 month after the procedure, with progressive improvement until 3 months. The effect at the level of central retinal thickness is only mild, but we observe a reduction as well. And we can also demonstrate a strong correlation between the restoration of focal integrity, mostly in the form of ellipsoid zone line, and the post-laser visual acuity improvements. So, and we can also say that we observe the absence of noteworthy complication after the laser procedure. As future perspectives, I would like to say that the Navilas microsecond pulsing laser treatment could represent a feasible tool to treat patients with macular edema due to branch retinal vein occlusion, mostly in particular conditions such as glaucomatous eyes, where we have to pay attention to use the steroid therapy, and in patients with a high cardiovascular risk which cannot undertake an anti-VEGF therapy. I would suggest the possibility to combine the microsecond pulsing laser treatment with the intravitreal therapies that we have, such as both the anti-VEGF or corticosteroids therapy, taking advantage of the effects regarding the focal integrity restoration of the microsecond pulse laser and the reduction of central macular thickness obtained with the intravitreal therapy. At the end, I would also say that this kind of treatment of integrated laser treatment procedure has the potentiality to perform a multimodal imaging guided treatment with the aim of the new implemented technologies such as web source OCT and OCT angiography. Thank you very much for the attention.